Hi everyone, this is Dr. RadhaLakshmi Senthil. Recently we discussed about express breast milk, and in today's video I'm going to talk about how do we do this expressing breast milk and how are we going to store. So express breast milk is something very important, especially if you have your newborn in the intensive care requiring milk feeds. The first and foremost is your hygiene. So to start with, wash your hands nicely. Use an alcohol sanitizer in your hand before you start expressing. Also, please check the bottle which you're going to use to store your breast milk. It is better you use a disposable glass bottles or even a disposable plastic bottles. So when you do so, you also check your pump and your pump connections whether they are nice and clean. Use a relaxing moment. Ideal would be a morning time to express because mothers tend to produce a large volume of milk in the morning time. So when you express, have a peaceful atmosphere and start expressing gently. You may do so using your hand. However, this may be painful, so consider using an electric pump or a manual pump. Initially, it might be difficult, especially if you are early days after delivery. Maybe in the first day or second day, you may not have a lot of production. Subsequently, it is bound to get better, provided you are in a relaxed, happy mood. So once you start expressing, you please store your breast milk in a container which is dated with the date and time of expressing. If you're not going to use your milk straight away, there are 3 different ways to store your breast milk. For instance, if you express your milk for nipping out for few minutes or few hours, in that case, you can store it in normal environment at a room temperature for roughly about 2 hours in the container. However, if it is going to be longer, please store it in a fridge. Make sure your fridge is in a good working condition with a temperature setup of at least 4 degrees centigrade. If that is a scenario, you can store your express breast milk in the fridge for 2 to 4 days maximum. So earlier the better you remove it. If you think you're not going to use this milk in the next 2 to 3 days, consider storing it in a freezer. If you have a freezer temperature at minus 18 degrees centigrade, this can be stored for 3 to 6 months. Now, how are we going to use this milk from the stored environment? So if it is in a freezer, remove the milk from the freezer to the fridge. Once your fridge consistency of the milk changes to a liquid consistency, that time this can be taken out. From this liquid consistency, you should use this milk within 24 hours after you've taken it out from your freezer. Never should you refreeze your breast milk. Never should you thaw your breast milk in a microwave or in a stove. The other ways of removing your breast milk to room temperature would be keeping your breast milk container in a pool of warm water or otherwise running it under a warm tap water. This is essential to preserve the nutrients in your breast milk. By all means, try to do a direct breastfeeding. That is more enjoyable, more pleasurable, and it is a dynamic process which will help you to produce more breast milk. If your baby is in intensive care and if you're expressing breast milk for your baby, try and maintain KMC with your baby, which means a close skin-to-skin contact with your baby. This will enhance your milk production and further help you with express breast milk.